All right, this is part 3. We got 200 more to go, and we're gonna do it. We'll try to get through it. Got music playing. Oops. Dun, 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 dun. Orienting attention. Orienting attention is shifting your attention from one object to another object driven by acetylcholine, which is secreted or produced in the basal forebrain. What are stimulants? Stimulants are something that increase your central nervous system, and they're also vasodilators. No, constrictors, not dilators. Beta waves are high frequency, and they're awake. Alpha is a drowsy state. Theta wave is just before sleep. Or alpha wave is awake but relaxed state. Theta wave is just before sleep, drowsy. Delta is deep sleep or coma. And these are short frequency, medium frequency, mid frequency, high frequency. Damaging effects of stress in our heart. So stress, again, increases blood pressure. So increased blood pressure will cause hypertension, which can lead to coronary heart diseases. Because our prefrontal cortex, thing that controls logic, is turned off during REM sleep. So that's why we devise logic. Sleep apnea is when you're unable to, or when you're sleeping and you're unable to breathe while you're sleeping, so you wake up in the middle of the night gasping for air and you go back to sleep without you realizing it. Robert Sturmer promotes analytical intelligence, academic ability, creative intelligence, and ability to adapt to new situations, and analytical, creative, and analytical intelligence, creative intelligence, and solving ill-defined problems. What was it? Practical intelligence. I'll do it again. What is filiform papillae? Is a structure that exists all over the tongue, and especially at the center of the tongue, and contains no taste buds. Pinna to stapes. Oh no. The pinna to the tympanic membrane is the external outer ear. Middle ear consists of the incus, the malleus to the stapes, which make up the three ossicles, and inner ear is the cochlea and the auditory canal. Semicircular canal. Damn it. Pinna to tympanic membrane. Malleus to stapes. Cochlea to semicircular canal. Group meetings, they're a 12-step program for drug addicts, and where they learn to acknowledge that they have an addiction, surrender to get help, and then they also help other drug addicts. Retroactive interference is when new learning impairs old info. So this is where learning a new address makes it hard to remember an old address. And proactive interference is where old learning impairs new info. So remembering an old password might make it hard to remember a new password. Linguistic universal theory argues that there's certain characteristics that exist universally across all different languages in the universe. All right. What are the 5 ways we can manage stress? Religion, coping, exercise, meditation, and cognitive flexibility. Place theory states that specific frequencies of sound, so high frequency, low frequencies, will hit certain parts of the cochlear basilar memory to trigger a specific response. Decision making terms is going trying to find the optimal whatever. It's not really an important flashcard. Or nerve fibers, the accruent fasciculus connects to Wernicke's and Broca's areas, also found in deaf people. Dissociation theory of hypnosis is that this hypnosis is a unique form of, or it's a special form of divided attention. And social influence theory says that hypnosis is when people do what they're basically told to do, like actors getting caught up in a role. If a government tells you you're a lizard, you think you're a lizard, you are a lizard. First stage of primary appraisal is which you're assessing the stress as either irrelevant, benign or positive, or negative, dangerous. Spreading activation theory. All ideas in your brain are connected together. Pulling up one memory pulls up others. It's like saying fire engines activates the memory of truck, fire, and red. All ideas in your brain are connected together. Pulling up memory pulls up others as well. Like saying fire engines activate memories of truck, fire, and red. What sort of medications can be used to treat tobacco addicts? Medications will deliver low levels of nicotine through patch or deliver chemicals that act on nicotine receptor and release to get dopamine, produce craving. There are medications that will deliver low levels of nicotine through patches or deliver chemicals that act on nicotine receptors in the brain, preventing release or reuptake of dopamine, reducing the craving. What's the medication used to treat medication that will deliver low levels of nicotine through patches or deliver chemicals that act on nicotine receptors in the brain, preventing release or reuptake of dopamine, reducing craving. How is a TRPV1 receptor used to detect pain and pressure? Heat causes conformation change in a protein. Make protein of cells causes cells to be broken up and release molecules that bind to TRPV1 receptors causes conformation change. How is the TRPV1 receptor used to detect pain and pressure? Heat causes conformation change in the protein. Protein poking of the cell causes cells to be broken up and release molecules that bind to TRPV1 receptors, causing conformation signals to brain. Oh, so for temperature, heat will cause a change in the TRPV1 receptor protein. Poking of cells causes cells to be broken up and release molecules that bind to the TRPV1 receptor, which causes conformation change to the brain. Anterior chamber. Space filled with aqueous humor and provides pressure to maintain shape of eyeball. And it supplies nutrients and minerals to cells of cornea and the iris. How are symptoms of alcohol? Benzodiazepines. Which hours sleep correlates? So 9 hours sleep is adults, 12 hours of sleep is babies, 7 hours sleep is adults, 9 hours sleep is high school children, 10 hours sleep is preschool children. But it's hard. Which memories will improve as you grow older? Semantic memories will improve until age 60, so adults have better IQs improve and emotional reasoning. Semantic memories will improve until age 80, so factual knowledge and verbal skills and IQ improves in emotional reasoning. Which appraisal theory of stress was made by Richard Lazarus? Stress arises less from physical events, but more from the assessment and interpretation of those events. Stress arises less from physical events, but more from the assessment and interpretation of those stress and events. Intentional blindness is not seeing something that's right in your face. When we focus closely on one thing, we often fail to see other things in plain sight. Cognitive behavioral therapy, they're long-lasting. Treatment for drug treatment, they develop positive thoughts, coping behavior, anticipate problematic situations, self-monitor cravings. Skills are very long-lasting. So, patients learn to develop positive thoughts, coping behavior, anticipate problematic situations, and monitor craving. This is very long-lasting. Ecstasy, MDMA, and Molly. Increases dopamine and serotonin release in the body's central nervous system. Will damage neurons that produce serotonin, which causes depressed mood because no serotonin equals depressed mood. Increases dopamine and serotonin release. What effects do ecstasy, MDMA, and Molly have? It increases dopamine, serotonin release, and stimulates the body's central nervous system, which will damage neurons that produce serotonin, which causes a depressed mood because no serotonin equals depressed mood. Increases dopamine, serotonin release, and stimulates the body's central nervous system, will damage neurons that produce serotonin, which causes depressed mood because no serotonin equals depressed mood. Ill-defined problems of doesn't have a clear start and end goal. For example, what's the meaning of life? Or examples of opiates. Natural opiates are morphine and codeine. Opiates are natural, so examples are morphine and codeine. Which system is located inside the accessory apophyse of the T1? Vomeronasal system may have basal and apical cells. Kinase receptors. Cocaine causes brain to release a shit ton of dopamine while blocking dopamine reuptake. Kill two birds with one stone. Universalism theory of language. Thoughts determine language completely, or thoughts dictate your language? Thoughts dictate language completely. Your thoughts dictate your language. This is the left hand of the spectrum. Thoughts determine language completely. What is recognition recall? Multiple choice exam. Answers right in front of you. Very easy to retrieve. Which type of memories or habits are implicit memory and stored in the basal ganglia? Habits are procedural memories, which is a type of implicit memory, and those memories stored in the basal ganglia. Yep. What is the pathway of sound for cochlear implants? You have a receiver, transmitter, and then I forgot what was it. Sounds pick up a microphone, sent to a transmitter outside the skull, and sends it to a receiver, sends it to a stimulator, and it sends it to cochlea, where it converts it to a neural impulse and goes to the brain. Sound is picked up by a microphone, sent to a transmitter outside the skull, to a receiver inside the skull, to a stimulator, then sent to a cochlea, where it converts it to a neural impulse and goes into the brain. Positive emotion evokes more activity on the left side of the brain, while negative emotion evokes on the right side of the brain. Negative emotions evoke more activity on the left side of the brain. Oh, negative emotions evoke more activity on the right hemisphere of the brain. So think about that. But positive emotions evoke more activity on the left hemisphere of the brain. What is prosody? Located on the right hemisphere and controls artistic functions like tone, stress, rhythm, sarcasm, etc. Located on the right hemisphere, contributes to artistic functions of speech like tone, stress, rhythm, and sarcasm. Olfactory epithelium, from our system, found inside the nasal passage of animals. Where are two main areas of language? Wernicke's area and Broca's area. The frontal lobe and Wernicke's temporal lobe. Okay, Broca's area is speak language in the frontal lobe. Wernicke's area is sound understanding language in the temporal lobe. What is joint attention? Two people paying attention to the same object. How can stress damage our immune function? Autoinflammation and inhibits immune activation. Responsive path. Causes inflammation and inhibits immune function, immune system activation in response to a stimulus. Autoinflammation inhibits immune system activation in response to pathogen. N3 sleep stage is characterized by deep theta waves, slow wave sleep, delta waves. Sleepwalking talking happens. Source monitoring is freaking where you got a source from. When people recall information and they forget the information of the source, the information source. When people recall information and they forget the information source. What are stimulants? Stimulants increases your central nervous system, and they're vasoconstrictors. Strong linguistic determinism, or the Sapir-Whorfian hypothesis. Language determines thought completely. Language determines thought completely. People understand what their world through language, and language shapes. Strong linguistic determinism. Language determines thought completely. Because it's a Whorfian hypothesis. Alarm phase. Initiation of stress response. How long do post-acute withdrawal last for? 2 years. Post-acute withdrawal lasts for 2 years. Lexical access. Identifying a word and connecting it to its meaning. That has been stored in long-term memory. Making up a word and connecting it to a meaning which has been stored in long-term memory before. That's lexical access. What are three types of intelligence imposed by Robert Thornburg? Creative intelligence, which is how you fit in new situations. Analytical intelligence is academic ability, and practical intelligence is solving ill-defined problems. What happens when you destroy hippocampus? Keeping old memories, but you just can't make new memories, so it causes anterior great amnesia. Keeping old memories, but you can't just make new memories, which is called anterior great amnesia. What is linguistic determinism? Language dictates thought completely. Yeah, language dictates thought completely. Weak linguistic determinism, and a strong linguistic determinism, which is a Whorfian hypothesis. Relativism. Language dictates thoughts And there's relativism and morphine hypotheses. What is attentional capture? Occurs when attention is attracted by the emotion of an object or stimulus. What boundaries define each of the classification? So external and outer ear is defined by the pinna to the tympanic membrane, which is the eardrum. Middle ear is the malleus to the stapes, which make up the three ossicles. Inner ear is the cochlea and the semicircular canal. Yes. Spreading activation theory. I forgot this one. Nope. Do I remember it? Spreading activation theory? Nope. All ideas in the brain are connected together. Pulling up memory pulls up others as well, like saying fire truck activates memories of truck fire. Right? What sort of brainwaves are alpha? Data, I forgot. Alpha waves in light meditation, theta waves in deep meditation. Alpha waves in light meditation, theta waves in deep meditation. What sort of medication we use for tobacco addicts? So you can give them a nicotine patch that delivers nicotine in small amounts, or give them a chemical that acts on nicotine receptors, which are actually acetylcholine receptors. But basically, you lower the nicotine, you basically inhibit nicotine's effect. So you decrease the amount of dopamine release, and you increase the amount of dopamine reuptake, which causes it to reduce craving. What sort of language means? So 9 to 12 months. I forgot what's it. Babbling, 1 word per month. Explosion of language and combining words. 3-word sentences by 5 years of age is language mastery. 9 to 12 months. 12 to 18 months. So a year. 1 word per month. Explosion of language and combining words. 2 to 3 years is 3-word sentences like I love you. 5 years is language mastery. So TRPV1 receptors for temperature. Heat causes a conformation to change, which fires action potential. For pain, when cells break up, they send fragments of their cell pieces to the TRPV1 receptor, which causes a change conformation and send an action potential. Anterior chamber provides pressure to the eyeball, contains the aqueous humor, and provides nutrients to the cornea and iris. Alcohols can be alleviated through the use of benzodiazepines. Which memories will improve? So semantic memories will improve until around age 60, and emotional intelligence and IQ also increases. Gate control theory of pain asserts that non-painful input closes the gate to painful input. This prevents pain sensation from traveling to the central nervous system. I think that's meant to say asserts. So having non-painful input closes the gate to painful input, which prevents pain sensation from traveling to the central nervous system. Appraisal theory states that stress more arises rather than the stress event itself. Actually arises from how we perceive the stressful event and how we appraise it or label it. Inattentional blindness is paying attention to something so closely in front of you that you forget that you don't see anything that is around you. Cognitive behavioral therapy is a psychological treatment of drug addicts, and the skills are very long term. They learn positive thoughts, coping behavior, identification of risky situations, and detection of cravings. Which memories will decline as you grow older? Recalling information becomes harder. Episodic memories are impaired. Slower processing speed, divided attention becomes harder, and prospective memory, which is doing things in the future, also decreases. Recalling information becomes harder, obviously. So episodic memory, processing speed slows down. Divided attention becomes harder, and prospective memory, which is doing things in the future, also decreases. Ecstasy, MDMA, and Molly all increase dopamine and serotonin transmission. And the problem is that they increase it so much that they'll eventually damage serotonin neurons. And the problem is that if you don't have serotonin, so no serotonin means you get into a depressed mood. Cool. Ill-defined principles have a clear start and end goal. Like, what is life? What are some examples of opiates? Opiates for natural, T for tree, morphine, codeine are 2 examples. The vomeronasal system is located inside the accessory olfactory epithelium made up of basal and apical cells with receptors at their tips. Cocaine will cause the brain to release a shit ton of dopamine and inhibit dopamine reuptake. Universal theory of language states that thoughts dictate language completely. Recognition recall is like a multiple choice exam. The answer's right in front of you, easy to retrieve. What types of memory? They're procedural memory, which are part of implicit memory and stored in the basal ganglia. What is the role of the thalamus in the limbic system? Thalamus is a sensory relay station. It directs most of your senses to the appropriate areas of the cortex and areas of the brains, except smell. Sensory relay station directs most of your senses into the appropriate areas of the cortex and the brain. Smell is the only sense that bypasses the thalamus. Pathway of sound of cochlear input. So we have the microphone goes to the stimulator, or similar to transmitter, or stimulator, transmitter, receiver, stimulator, cochlea, transformed to neural impulse sent to the brain. Positive emotion evokes more activity on the right side of the brain. Negative emotions evoke more activity on the left side of the brain. Or negative emotions evoke more activity on the right side of the brain. Negative right side because I got bugged by my right side of the brain. Okay. What are the 3 emotional behavioral effects of stress? Emotional behavioral effects of stress? Anger, anxiety, and addiction. Anger, anxiety, and addiction. Prosody is located on the right hemisphere brain, and it's a small region of the brain that's controlling the more of the artistic functions of speech, like tone, rhythm, and sarcasm. The olfactory epithelium is located in the nasal patches of most animals. The Broca's area, which controls speech production in the frontal cortex, and the Wernicke's area in the temporal lobe, which controls speech understanding. Joint attention is paying attention to one single object by 2 separate people. Stapes moves back and forth at the same frequency at the stimulus at the same frequency as stimulus and pushes the lip to a window back and forth. The stapes moves back and forth at the same frequency as stimulus and pushes the elliptical window back and forth. How does stress damage it? So it causes autoinflammation and prevents the immune system from responding to pathogens. And the 3 sleep stage is characterized by delta sleep waves. And this is where sleepwalking, sleep talking happens. Source monitoring areas, recalling the information but being able to remember where the information came from. How do you know when someone has a substance use disorder? Look at their substance usage. Are they using large amounts or spending more time recovering from the drug? Yes. Yeah. Huh? Oh, thank you. Oh yes, thank you. How do you know when someone has a substance use disorder? You look at their substance usage. Are they using large amounts or spending more time recovering from the drug? You can also look at for withdrawal, such as feeling sick, unwell after having stopped for a drug for a long time. How do you know when someone uses substance use? You look at their substance usage. Are they using large amounts or spending more time recovering from a drug? You can also look for withdrawal, such as feeling sick, unwell after having stopped from what? So, high amount of usage, high recovery time, and withdrawal symptoms. High amount of usage, high recovery time, withdrawal symptoms. Okay. Strong linguistic determinism, or otherwise known as the Sapir-Whorfian hypothesis, states that language dictates thoughts completely. Alarm phase is when our stress reaction kicks in. Because there's an alarm, your stress reaction is going to kick in. How long does post-acute withdrawal usually last for? Post-acute. So a little bit after, usually after 2 years. Lexical access is finding a new word in a new language and associating that new word with some sort of knowledge you have from your long-term memory. What happens when you destroy the hippocampus? You're able to retain old info, but you are unable to form new info, which is anterograde amnesia. Linguistic determinism is that language has some influence on thought. And the two types are the weak linguistic determinism, which is relativism, and strong linguistic determinism, which is the Whorfian hypotheses. Cepheid-Whorfian hypotheses. Attentional capture is capturing our attention based on the motion of an object. Substance-induced disorders, conditions that are caused by substances such as high mood and low. I don't really remember this. Conditions that are caused by a drug. Conditions that are caused by a drug. Okay. What is the optic chiasm? Optic nerves from each eye will merge to this point where info from the right visual field goes to the left side of the brain, info from the left visual field gets sent to the right side of the brain. Contralateral organization. Optic nerve from each eye will merge at this point. Info from the right visual field is sent to the left side of the brain. Info from the left visual field is sent to the right side of the brain. What sort of brain waves are present during meditation? During meditation is alpha waves. During deep meditation is theta waves. Describe the pathway of molecules coming and activate receptors in the basal apical cells. Okay. So molecules bind to the basal apical cells and signal them to, so we forgot about this. Basal cells will send axon through accessory olfactory bulbs to the glomerulus to medial tuft cells back to the amygdala in the brain. Basal cells will send axons through accessory olfactory bulbs to the glomerulus, to the medial tuft cells, to the amygdala. Basal cells will send axons through accessory olfactory epithelium, glomerulus, axons through accessory glomerulus, central tuft cells, amygdala of the brain. Accessory olfactory bulbs, glomerulus, medial tuft cells, amygdala of the brain. Okay. 9-12, blabbling, 12 to 18 months. 1 word per month, 18 to 20 months, 3-word sentence, 2 to 3 years old, 3 words, 5 years is full-on language, speech, babbling, about 1 word per month. Explosion of language and combining words. Spreading activation says that when you pull memory from your brain, you're also pulling other things with it. So, for example, if you're thinking about a fire truck, you might pull the color red, trucks, cars, sirens, etc. So they're all connected. How does a molecule bind to olfactory epithelium and cause action potential? G-protein couple receptors traveling these G-protein couple receptors. So G-protein dissociates, activates chloride channels, which causes influx of ions to trigger an action potential. Oh, shoot. I put that so long. Oh, well. What is gate control theory of pain? It says that when you get painful, non-painful input, that closes the gate to painful input, and that prevents painful info from being sent to your central nervous system. What is manifest content, latent content? Manifest content is the actual meaning of G. And they're components of the Sigmund Freud theory of dreams. Component of Sigmund Freud theory of dreams. What's literally happened? Hidden symbolism, component of Sigmund Freud theory of dreams. What is chunking in terms of memory? Chunking in terms of memory, huh? So chunking is grouping info we are getting into categories to ease memorization. Grouping info we are getting into categories to ease memorization. What is the Sinher theory of emotion? Physiological and cognitive responses simultaneously form experiences of emotion. Physiological and cognitive response simultaneously form an emotion. Events and you have a physiological it's cognitive ability to understand what's happening. Let's say event physiological response, identify the reason for the physiological response, and you have an emotion. Yeah, physiological and cognitive responses simultaneously form experience. The event physical identify the reason for the physiological response that happens simultaneously. So as you processing speed goes down, recalling becomes harder, divided attention becomes harder, episodic memories become degraded, and your prospective memory, remembering to do things in the future, also becomes degraded. Emotion behavioral effect of stress is anxiety. An emotional behavioral effect of stress is anxiety, which centers on the amygdala. Vitreous chamber contains the vitreous humor and it supplies nutrients to the cones and rods. Nutrients inside the eyeballs. Filled with vitreous humor and provides pressure to eyeball and gives nutrients to the inside of the eyeball. Lexicon, it's not lexical access. A set of vocabulary items, so basically vocab words. What is the role of the thalamus in the limbic system? So the thalamus is a sensory relay center. So it will take all your senses from the body and then it relays it to different cortexes and areas of the brain, all except for the sense of smell. C fibers are the slowest fibers. They are have small diameters and they're basically unmyelinated. Oh shoot, that was supposed to be the other one. What is Vygotsky's theory of language and thought? Language and thought are independent but converge through development. We eventually learn to use them at the same time via socialization. Vygotsky said that. Language and thought are independent but converge through development, and we eventually learn to use them at the same time via socialization. Okay. What are the three emotional? Anger, anxiety, and addiction. When you're stressful, you're addicted to like games or whatever. Universalism theory of language states that thoughts determine language. Positive emotion evokes more activity on the left side. Negative emotions evoke more activity on the right side. And appraisal is negative secondary appraisal, which is the evaluation of the individual's coping. We evaluate harm, threat, and challenge. Evaluation of the individual's ability to cope with the situation. Harm, threat, and challenge. What does sapiens do? It vibrates at the same frequency as the stimulus and moves the elliptical window back and forth. L.L. Thurstone's theory of intelligence. 7 factors of intelligence. I'm not going to memorize all these. L.L. Thurstone, 7 factors of intelligence. I think that's good. Howard Gardner states that we have, I think it's like 9? And each intelligence depends on the other, and hence intelligence in one area does not intelligence in the other. That's the only important part we need to know. So Howard Gardner says that we have 9 independent intelligences, and each intelligence doesn't depend on each other, and hence intelligence in one area does not predict intelligence in the other. What 2 things do human needs to ear sound? Well, stimulus and hair cells. Stimulus and hair cells. First, you have a central executive, which stores is a component of working memory that combines the visuals and the flows on a loop. So memory in the episodic buffer, which is moved to long-term memory in the hippocampus. What is sensory adaptation? Because if neurons keep firing, they'll eventually die. If a cell is overexcited, the cell can die, basically. When rhodopsin changes shape, transducin breaks up from rhodopsin and alpha subunits bind to another DIS protein called phosphodiesterase. Transducin breaks off from rhodopsin, and alpha subunits bind to another DIS protein called phosphodiesterase. How do you know when someone has a substance use disorder? You look at their withdrawal symptoms, their high substance use, and their recovery time. High recovery time, high substance use, and withdrawal symptoms. How do exogenous cues play a role in our attention? Driven up by bottom-up or external events, these are cues that catch our attention like a loud-ass blue angel flying by. Driven up by bottom-up processing, and these are cues that catch our attention. driven up by bottom-up processing or external events used to catch our attention. What happens to a patient that has a severed corpus callosum? Left side is needed for language, right side is needed for action. Right. So if someone sees an object on their left, the info is sent to their right side, so they can do the motor function, but they can't name the object. Okay. What is global aphasia? Basically, everything's fucked. Broca's aphasia, Wernicke's aphasia are present, so language is globally affected. Can't speak or understand language at all. Phosphodiesterase takes cGMP, converts it to GMP. James Lange theory of emotion. Experience of emotion is due to perception of physiological response. For example, holding your cat elicits an emotion of happiness because of an increased heart rate, and you interpret increased heart rate as an emotion, a positive emotion. Substance use disorder is the result of taking a drug, so the effects of taking a drug. Optic chiasm is the point where the optic nerve from both eye hits this point, and this is where info from the right visual field goes to the left side of the brain, vice versa. The amygdala in the limbic system. Aggression center. Stimulation produces anger, violence, fear, anxiety. Anger, violence, fear, and anxiety. Aggression center. Stimulation of amygdala produces anger, violence, fear, and anxiety. Narrow hearing loss. Individuals that have a conduction of sound waves from the cochlea to the brain. Sensory narrow hearing loss. Individuals that have a problem with conduction of sound waves from the cochlea to the brain. The brain relies on the cochlea to differentiate between two different sounds of different frequencies for tonal mapping. What is one way to tell someone has learned something before? How quickly they can remember it or relearn it? Where do we receive input? Sensory register. We receive input into sensory register. Describe the pathway when a molecule comes to activate. So we activate basoepic cells. They send synapse to the olfactory bulb, going to the glomerulus, goes to mitral tufted cells, which goes to the amygdala of the brain. Five monocular clues: relative size, relative height, shading contour, motion parallax, overlapping, interposition. Relative size, relative height, shading contour, motion parallax, interposition. Piaget's theory of language and thought. This is about the kid guy. Children's thought a certain way. It's all about children, and then develop language to describe those thoughts. Children's thought a certain way, and they develop language to describe those thoughts. 9 to 12 months is babbling. 12 to 18 months explosion. 12 to 18 months is 1 word per month. 18 to 20 words, an explosion of words that don't make sense. 2 to 3 years is 3-word sentences, and 5 years is language mastery. What sort of memories will remain stable when you grow old? Implicit recognition memory. Riding a bike and being able to pick something out of the list. Implicit recognition memory. What Johnson and Hayes proposed about the attenuator? It can be varied depending on the task. This means the full task can be attended. Can be varied by the listener depending on the demand necessitated by a particular attention task. What is manifest? So part of the Sigmund Freud theory of dreams, manifest content is literal meaning dreams, and then content is symbolic meaning of dreams, like a job is pushing you out or a monster is chasing you. Chunking is how we chunk together or categorize small memories together. Like, for example, you put oranges, bananas as fruits. What is the interactionist Vygotsky to language? So Vygotsky is a social guy, and he thought that language and thought were separate, and we eventually are able to converge them together through socialization. Oh, never mind. Oh, language development. Social factors and biological factors interact for babies to learn language. It's due to a child's desire to communicate with others that motivates them to learn a new language. It is due to a child's desire to communicate with others that motivates them to learn a new language. Singer's theory of emotion says that we have an event and we have a specific physiological response, and then we interpret the physiological response, which allows us to produce an emotion. And the interpretation of the physiological response and the physiological response itself happens simultaneously to produce an emotion. An emotional behavioral effect of stress and anxiety, which centers on the amygdala. Why would Chomsky argue it's harder for... Because adults don't have the LAD. 0 to 9. There's a critical period from age 9 to 9 when after age the LAD deactivates and becomes harder for learning a new language. Vitreous chamber provides pressure to the eyeball, contains a vitreous humor, and supplies nutrients to the eyeball. Or to the eyeball. Lexicon is a set of vocabulary items. Cannon-Barr theory of emotion. Some physical responses, such as raising mature, is both so they discouraged. So he believed that physiological response and experience emotion occurred simultaneously. Like heart beating and then happiness occurred simultaneously. Acute withdrawal occurs a few weeks after withdrawal, composed of physical symptoms. Describe the pathway when a molecule comes in through the nose and binds to the basoapical cells receptors, G protein specifically, signals action potential to the olfactory bulb and to the glomerulus, so they mutual tufted cells, and then sends them to the amygdala of the brain. Okay, oops. Put it as again. What is Vygotsky's theory of language and thought? So Vygotsky argued that language and thought are, they're both separate, but they converge to each other as you grow up and interact through socialization. Two stages of withdrawal is acute withdrawal and post-acute withdrawal. The appraisal theory has two stages of stress. If the appraisal is negative, the second stage is secondary appraisal, in which we assess our body's ability to cope with the stress, its level of danger, and how much of a danger it is. Oh, oops, whatever. What is L.L. Thornstone's theory of intelligence? So Thornstone argued that we have 7 general intelligences. How does stress damage our reproductive system? During stress in women, reproduction gets shut down by reduction in FSH, so they get reduced testosterone erectile dysfunction. Yikes. During stress in women, reproduction gets shut down by reduction in FSH and LH. During stress in men, you get reduced testosterone and erectile dysfunction. During stress in women, reproduction gets shut down by reduction in FSH and LH. During stress in men, you get reduced testosterone and erectile dysfunction. Wow, I'm tired. During stress in women, reproduction gets shut down by reduction in FSH. During stress in men, you get reduced testosterone and erectile dysfunction. My voice is also getting cracky too. But I'm just chilling. Whew. Okay. Come on, 120 more. Thanks. During stress in women, reproduction gets shut down by reduction in FSH and LH. During stress in men, you get reduced testosterone and erectile dysfunction. Howard Gardner's theory of intelligence states that we have 9 independent intelligences, and these intelligences do not predict, or intelligence in one area does not predict intelligence in other areas. What are 3 emotional behavioral effects of stress? Anger, anxiety, addiction. What 2 things you need? Stimulus and you need hair cells. First, you have an essential executive, which is a component of working memory that combines visual, spatial, state pattern, and logic loop to short-term memory in the episodic buffer, to be moved to long-term memory in the hippocampus. What is sensory adaptation important? Because if cells become overexcited, they can die. When rhodopsin changes shape, transducin breaks out from rhodopsin and alpha subunits bind to other dysproteins called phosphodiesterase. Or their enzymes, but yeah. How do exogenous cues play a role in our attention? Exogenous cues are external cues, or cues that catch our attention, like a loud-ass Blue Angel plane flying past by you, and they're driven up by bottom-up processing. What happened to a patient that has a severed corpus callosum? So if you separate your two hemispheres of the brain, you know that the left side is responsible for language and the right side is responsible for action. So if you see something on your left side, for example, you see this pen, for example, you see on your left visual field, but then that gets sent to the right side of your brain, which controls motor function. So you're able to pick up the pen, but you're not able to use the left hemisphere of your brain to actually name the pen because it's separated, so you can't communicate between the two. Global aphasia is when you have Wernicke's aphasia and Broca's aphasia both at the same time. So language is completely useless to you. Phosphodiesterase takes CGMP and converts it to GMP. James Lang's theory of emotion states that emotion is based on a physiological event, or our perception of physiological events, rather. And the way that works is that if we see a cat, we pick up the cat, we have an increased heart rate, and we interpret that increased heart rate as feelings of happiness. So, phototopic vision occurs at high levels of dark. Scotopic and mesotopic occurs at very low light. Phototopic, high light levels. Photos have highlight. Mesotopic, middle, occurs at dawn and dusk, involves rods and cones. Scotopic vision occurs at very low light. The amygdala is the aggression sensor, so involved in aggression, mating, emotion. Sensory nerve hearing loss is when you're unable to conduct sound waves from the cochlea to the brain. The brain relies on the cochlea to differentiate between two different sounds of different frequencies. This process is called tonotopical mapping. What does wanting to tell someone? How quickly they can relearn something? It means that they have a foundation of the memory. We receive input in the sensory register. So physiological input, heart rate increases, muscle tense up, skin temperatures increase, etc. Cognitive experiences dictates how you interpret an emotional response. Behavior-wise, you might give out body language and facial expression. What is a physiological component? Physiology, heart rate might increase, muscle tenses up, temperature increase, etc. Cognitive dictates how you interpret that emotional response. Some people like surprise parties, some people don't. Behavioral-wise, you might give out body language and facial expressions. 5 monocular cues. Inner position, relative size, relative height, motion parallax, and contour, shading contour. Piaget's theory of language and thoughts says that children thought a certain way, and they use words to describe these unique thoughts. Limbic system controls emotion. Contains hippocampus, hypothalamus, amygdala, and the thalamus. Set of structures in the brain that plays an important role in regulating emotions. Contains the hippocampus, hypothalamus, amygdala, and thalamus. What sort of memories will remain stable when you grow old? These are your implicit memory and your recognition memory. So you're able to still remember how to ride a bike or like drive a car, but you're also still able to like pick out things from a list because you have recognition memory. What did Johnson and Hayes propose about the attenuator? So they thought the attenuator can vary from individual to individual based on the necessity required by the demanding of the task. What is learned helplessness? You learn from having control ripped out of your hands that you don't have control, so you lose the ability to identify coping mechanisms. This one was kind of hard, actually. Yeah. You learn from having control ripped out of your hands that you don't have control. So you lose the ability to identify coping mechanisms. That's how I remember. What is meaning-focused coping? Person concentrates on deriving meaning from a stressful experience in order to cope with stress. Deriving meaning from a stressful experience to cope with stress. Long-term potentiation is the strengthening of nerve cells, of neuron connections to strengthen the memory rather than growing more neurons. Connection between neurons only strengthen, supports plasticity hypotheses. Interactions approach to language. So Vygotsky thought that there are social and biological factors that play into children developing language. What was I going to say? Children have a desire to communicate with people, and that's how they were able to learn language. Our working memory is, I think, like 9 digits. 7 plus or minus 2 pieces of phone, 7 digits long for the most part. 7 plus or minus 2 pieces of information. Why would Chomsky argue that it's harder for adults to pick up learning a new language? Because adults, the LAD, language attenuating device, is only available from ages 0 to 9. And after 9, it basically deactivates. So that's why adults make it harder to learn a new language after ages 9. A spindle. Tiny receptors in our muscle that send signal to the brain contains perceptions to know how contracted every muscle is. Tiny receptors located in our muscles that send signals to the brain and contains a protein that is sensitive to stretching, allows us to know how contracted or relaxed every muscle in our body is. Okay. Tiny receptors located in our muscle that send signal to the brain contains a protein that is sensitive to stretching, allows us to know how contracted or relaxed every muscle in our body is. Tiny receptors located in our muscles that send signals to the brain contains a protein that is sensitive to stretching, allows us to know how contracted or relaxed every muscle in our body is. This is basically like a mini MCAT. Tiny receptors located in our muscles that send signals to the brain contains a protein that is sensitive to stretching, allows us to know how contracted or relaxed every muscle in our body is. Okay. Cannon-Barr theory of emotion states that he disagreed with the James Lang theory of emotion in that he said, well, if there's a beating heart, you can interpret a beating heart as like you're running away from a bear and you're scared, or a beating heart as being happy. So there's got to be something there. Well, he argues that the perception of a physiological response and the emotion actually happen simultaneously. Acute withdrawal is the physiological effects of withdrawing from a drug. It typically happens, lasts for 2 weeks after withdrawal period. Singer theory of motion states that we first have an event, a physiological response, and then we interpret that physiological response, which allows us to get emotion. And the interpretation of the physiological response and the emotion actually occurs simultaneously. Benzene comes into the nose, binds to basal apical cells, fires action potential to the olfactory bulb, synapses on the glomerulus containing medial tuft cells, and sends signals to the amygdala of the brain. Two stages of withdrawal is the acute phase and the post-acute withdrawal phase. Define each of the following maladaptive coping mechanisms. Oof. Association. We're getting about stress. Sensitization, researching, learning stuff to prevent the stress from happening in the first place. When stress, running away. Okay. Alzheimer's disease. I don't think I remember it. Neurons dying off over time. Cerebral cortex shrinking contains a buildup of amyloid plaques in the brain. Neurons dying off over time as neuronized cerebral cortex shrinking size contains a buildup of amyloid plaques in the brain. How does stress damage our So in women, it disrupts reproduction, or basically inactivates reproduction because it reduces levels of FSH and LH. And in men, stress causes a reduced level of testosterone and causes erectile dysfunction. Gestalt's law of closure states, for example, we have a panda. We tend to fill in the missing information. What are the 4 factors that can influence the absolute threshold sensation? Expectations, experiences, motivation, alertness. Expectation, experience, motivation, alertness. This vestibular system is used for balance and spatial orientation. Located in the inner ear, and it's used for balance and spatial orientation. The sclera absorbs light, and it's the white of the eye. Well, actually, it reflects light. I don't know. It absorbs light. It's whatever the eye. If the appraisal is negative, the second stage is for which we evaluate for our ability to cope with distress, the dangers of distress, and the threat, harm, threat, challenge. Mean and analysis and working backwards. Breaking down big problems into small problems. Working backwards, start with the goal, using proof and mazes. How does visual sensation occur? Let's convert to neural impulse by a photoreceptor. What is narcolepsy? Narcolepsy is narcolepsy. What is narcolepsy? Anybody fall asleep? Oh, they can't involve various fits of sleepiness and go into REM sleep. Learning reduces processing time? Yeah. All right, that's 100 words. I'm going to take a break again, and I'll be back shortly.